Hi there, I'm Dr. Blazer. I am a dentist at NorthShore Health Centers, and I'm actually the director of the dental program as well. I myself have seen OB, chiropractic, medical, optical, at multiple sites across the company. Having the perspective of a patient and being able to translate that to our department's experience is really valuable to me. So I know a ton about teeth, but I have no idea what goes on in optical or OB or any of the other departments. So I'm not as familiar with those processes. So being able to come here and see how easy it is to check in and do all this other stuff and be guided by all the other departments that know how to navigate you as a patient through those things, that means that I can take a look at dental and say, okay, this is what it's like being a patient on the other side when you don't know a ton about that type of healthcare, and then try to make it so that it's easy just as much for the patients that see dental as for me when I go to the other departments. It's nice to be able to refer family members and know that they're going to be taken care of well.
Hi, I'm Dr. Matt Monaco. I'm a chiropractor here, and my role is basically to provide the best health care that I can for any of our patients that come through our door, whether that's back pain, neck pain, numbness, tingling, really any kind of physical symptoms that a patient may have. We do our best to provide any kind of care that we can. When I graduated school and I was kind of, interviewing around and I came across NorthShore, I really kind of fell in love with just the message that, it doesn't matter who you are or where you're from, everyone deserves the same care. And I think NorthShore does a really, really great job of kind of embodying that.
Hi, my name's Alexandra McBurney. I'm an optometrist at NorthShore Health Centers in Chesterton. This is such a wonderful place to work in the sense that we're able to provide such great care to our patients in such an integral way that so many of our body parts are so connected with everything. Yes, we go see our primary care doctor and that's so important, but a lot of other things get put on the back burner. Being able to inter-refer between all of our providers is so great, and to take care of the patient as a whole. There are so many things that go undiagnosed until we maybe have a problem. That's why routine eye care is so important, to catch things on an early side, and imperative with preventative medicine. We don't want to wait till we have a problem. We want to catch it beforehand. And our providers here are actually so great at pushing people to do all those things and getting patients to understand that their eyes tell us so much about the inside of their body and vice versa.
We want the right person that believes in our values, that will translate that to the patient. At the end of the day, we are here to serve the patient, and we're all willing to give up a little bit and sacrifice to do that. Healthcare is complicated and difficult. Most people don't understand all the stuff that goes into it and why you have to bounce through so many hoops. If you go to your primary care, you're having a bad day, it's more of a mental issue today than a healthcare issue, but it affects so many different things. Before you walk out the door, you're going to see your behavioral health specialist, because we have that ability for your primary care to walk you right outside your exam room to another one and introduce you to a licensed clinical social worker and get your help before you walk out the door. And before you leave, if you need prescriptions, it's before you walk out the door. And your referrals are before you walk out the door, to make it as easy as possible to get you the care before you walk out the door.